Dr. John Fildes is the Associate Dean for External Affairs at Kerkorian School of Medicine at the University of Nevada, Las Vegas. In addition, he is professor and inaugural chair of the Department of Surgery. He also served as interim dean from September 2019 through April 2020. Dr. Fildes' specialty is acute care surgery, a combination of trauma, surgical critical care, and emergency general surgery. He established the first American Association for the Surgery of Trauma approved fellowship in acute care surgery in the U.S. and was its program director for over a decade. Dr. Fildes was the medical director of the Trauma Center and chief of the Department of Trauma and Burns at the University Medical Center in Las Vegas from 1996 to 2019. UMC is Nevada's only level 1 trauma center, only pediatric trauma center, and only burn center. He was a leader in the medical response to the 1 October shootings in Las Vegas, and President Donald Trump commended him and his surgical team for their care of the shooting victims. Dr. Fildes is the recipient of many honors and awards. He received the Las Vegas Chamber of Commerce Achievement Award, was named as Nevada's Distinguished Physician, Healthcare Hero, Best Doctors of Southern Nevada 6 times, and honored by the Mayor of Las Vegas, who proclaimed May 12th as Dr. John Fildes Day in the city of Las Vegas. He also received the Dean's Distinguished Service Award, Foundation Professor Award, and was named an outstanding teacher and full-time professor on numerous occasions by medical students, residents, and fellows from several training programs. Dr. Fildes is the recipient of certificates of appreciation from the White House Medical Unit in 1998 and 2017, the Centers for Disease Control in 2009 and 2012, and the U.S. Air Force in 2016. Ladies and gentlemen, it's my pleasure and honor to introduce an honorary fellow of the Philippine College of Surgeons, Dr. John Fildes, who will be giving his lecture on the surgical theater and the Academe, a balancing act.
Well, good morning to everyone. I'd like to welcome you all to this webinar, and I'd like to thank Dr. Dela Cruz for his invitation to speak. I must say I was intrigued by the title and topic that he gave me. So following my surgical, like a surgeon, I dissected this topic and found the following. Theater really refers to early rooms for surgery, where learners would be literally theater seatings in the galleries in order to learn the craft of surgery. The Academe, in its best description, talks really about a community of scholars, about a place of instruction and the habitat and the culture of learning that results from that. So the contemporary question is, how do you balance your time as a mentor and a teacher, operating room particularly, that as a leader and an administrator, or your healthcare organization, your hospital, or your university? I always say that you don't know how to lead until you understand who you're leading and what they do. And being involved at the clinical level is critical. So let's look at the objectives for today. First is really to define the concepts of academic surgery, to discuss the work-life balance, and understanding how to implement these into a career in academic surgery changes that equation to work as a surgeon. To accomplish this, I'm going to talk about some current literature, share some past personal experiences, and try to create some strategies to address these challenges. And I'm going to assemble some useful tools and some concepts that you can use to manage these competing priorities. I often say that academic surgery is like a three-legged stool. Patient care, it's teaching, and it's research. Patient care includes the entire spectrum from early recognition of surgical conditions or the event of injury, and of course, scans into intervention at the trauma clinics and then into the operating and beyond. Teaching is nearly continuous with this and synchronous with this. For most of us, our learners are our advanced medical students or our residents who are shoulder to shoulder with us as we go through our daily patient care routines. And research is more than working with test tubes and gels. It really is the creation and dissemination of new knowledge of all types and the advancement of the standard of care. And those three things can be competing problems. They're seldom divided equally into 1/3 effort, 1/3 effort, and 1/3 effort. And they evolve over your time in your surgical career. Early on, patient care is going to have the highest weight. Teaching is going to be constant, and research may change up and down depending upon interests, grant funding, available time, and other sorts of things. So just to demonstrate that there is a way to quantify this, this would be a traditional daily schedule for many people. Up at 6 in the morning, a little bit of free time to, take care of dressing and up, looking at mind, body, and spirit issues. Have some breakfast, drive to work. By 8, you're started. By you finished your morning session, an elective OR suite, maybe in a clinic. Have some lunch, have an afternoon session, another 4 hours, 8 hours of work. You drive home, you have some free time with family, share dinner, a little bit of personal time before you go to sleep and sleep 8 hours. So this would be a traditional schedule. And if I were to ask for a show of hands, I would imagine that only a minority of people on this webinar actually live a life like this. What's more likely is you live a surgeon's daily schedule. You're up at 5 or 6 in the morning, you have to get up and get out. More often than not, 5 into work, you may catch some coffee there or eat standing up while you're doing rounds. First case, you've got block time to start on time. That usually, with delays, means that lunch is really questionable. By the afternoon, you have to be at the clinic to see your post-ops and your new pre-ops. At the end of the clinic, there's paperwork and billing to be done, and then check on that day's post-ops. And if you're lucky, you get to drive home and have dinner about 7 o'clock, and you might have an hour or two of free time before you sleep less than 8 hours. And I call this the 50-50 schedule. You're about 50% of the day engaged with work and 50% with all other things. And the largest thing is sleep. So for me, when I do work, I am fortunate to work in a trauma center at a 7 a.m. to 7 p.m. shift. And I'm fortunate that I can contain my schedule and control my schedule in that way. But this brings up the topic of work-life balance. This describes the relationship between what commitment you make for the rest of your life, how one impacts the other. I show this cartoon because I use this analogy all the time. I will sometimes feel like I'm a juggler trying to keep these plates spinning on the sticks. And my greatest fear is I have too many plates spinning at one time, and all of them will come down. It's a very uncomfortable professional feeling. And it's one of the things that leads to burnout, when you feel like you're out of control or you're just on the verge of disaster because you have too much going on and too many things that are teetering on the edge of running out of control. So really, work-life balance is about trying to find some peace and some balance between the demands of work and those that are important to your personal life, and those things that bring you fulfillment and happiness in your personal life. And it takes time to realize that. The next surgical career is so exciting, particularly as a young surgeon. The need and the want to operate, care for patients, and be engaged is really, really strong. This is a very recent paper, 2021. It's by Brown, Joseph, Davis, and it was a survey of members of the American Association for the Surgery of Trauma, and it looked at factors that are associated with improved work-life balance or dissatisfaction with balance. And they found that statistically significant areas were identified. These factors that improved were things like hobbies, healthy diet, exercise, weekends off, fair compensation, and things that made surgeons' work-life balance unhappy were being in mid-career and the pressures that brings, more working hours as opposed to fewer awake hours at home at the end of day or early in the morning, and a feeling that there's a better job out there somewhere, that you're stuck in a rut. Sadly, only 43% of trauma surgeons were satisfied with their work-life balance, which means the majority of trauma surgeons are unhappy. And this paper goes to show that if you look at the factors, these are controllable. Other sorts of personal development. To learn the new skills that I need, I have to go out and read some of the best personal improvement books, improve myself and give myself the tools that time management was one of the first things that was most important to learn. It made me refocus on what's important, and really how to prioritize high impact from low impact work, and to put myself on a course of not reacting to everything, but responding to everything. Time management is not easy to learn. It really, remember the pie charts at the beginning. You can't make the pie chart bigger. Only the slices that get bigger and smaller. It's up to you to control the size of the slices. You have to make time for yourself. Mind, body, and spirit are the key elements to personal self-care. You need to make sure that each day you have to strengthen your relationships with your friends, your colleagues at work, your family. You have to schedule yourself, and you have to protect certain days and times of day to make sure that all of these priorities are serviced properly. And I like to use things like to-do lists. And, I spend a few minutes at the beginning of every day and a few minutes at the end of every day, either creating or reviewing the to-do list. And I make them in a realistic way so that I don't feel like I've failed at the end of the day. I always like this quote at the bottom here. I'm going to take a course on time management just as soon as I can work it into my schedule. I remember myself saying that at one point in my career. The strategies to confront these challenges really organization. If you believe you can control your schedule and think about the pie chart, the next thing to do is to figure out what's this rubric on the bottom comes from Stephen Covey. His work was particularly and really one of my favorites. But I start with mission, vision, and values, and we hear that often, and you almost get tired of it. I like vision the best. When you say to somebody, our practice, our group is going to become the best trauma center in our region. They believe in the vision. They don't know how to get there. That's your job. You have to take them there. But if people believe in the vision, the rest falls into place. The next most important one to me are the values. The values are kind of like the rules of the game. It's kind of like what the referee follows in a sporting event. It's how you get to where you want to go. And if people buy into the values and they have the vision, the rest of your work becomes very, very easy. High impact work means that you want to do the most for the most people. You want to do the best you can for the most people, as opposed to running around and doing individual things for individuals. Low impact work is unfortunately a reality. We're flooded with low impact work. You could almost call low impact work email. Everybody throws everything they can at you to see if it'll stick. They don't want to take the monkey off their back and put it on your back. You have to find ways to delegate. You have to find ways to say no. And in this, you can see things like in box 1 here, a task is important and it's urgent. Well, what would that be? Well, that would be a patient with a ruptured spleen and hypotension. You would drop everything. You'd go take care of that. Or if your child was ill, you would drop everything, go take care of that. That's box 1. That stuff is your responsibility. Box 2 is stuff that's important but not urgent. Box 2 is the most frequently sacrificed. It would be things like finishing your manuscript or sending in a grant proposal or scheduling a meeting with the president of the university to create a new program. This is where real creativity, ingenuity, and progress takes place, and unfortunately is the most often set aside because people's attention are drawn to box 3. These are things that are urgent or are presented to you as urgent, but are not really important. You get a phone call from the Board of Regents. You have an emergency meeting by the CEO of the hospital who wants to react to a problem as opposed to respond to a problem. One of the residents didn't want to wear a hat in the operating room, so now you have an emergency meeting. That's box 3. That's a waste of your time. And box 4, of course, everybody can say that if something's not important, it's not urgent, then you should just delegate it. You just shouldn't get involved with trying to answer emails about invitations to holiday parties and other sorts of things. You can have your staff help you with all of that sort of thing. You really need to stay focused on boxes 1 and 2. Other strategies that I had, this is particularly true when I was in the dean's office. The 10% of my time clinical, and that meant essentially half a day once a week. What I did is the 4 weeks of half days added up to 2 full. So I would go into my schedule months in advance, and I'd schedule myself consecutive days of trauma call, and I would protect it. I wouldn't let anybody touch it. Didn't matter who called up. The answer was no. I was going to take trauma call. And I made sure the residents knew what days those were, so they had OR cases queued up for me. And if somebody insisted that they had to see me or talk to me, my rule was that they had to walk to the trauma center and sit in the waiting room and wait for me to be available to talk to them. And the good news is that nobody ever came. I chose a new direction with personal health and fitness. I changed positions. I went to an internal medicine doctor now whose practice is focused on health promotion and anti-aging, as opposed to a physician, my old physician, who was focused on disease treatment. Still working to improve my exercise routines, but my diet and my general health approach, my sleep cycles have all improved dramatically. I learned from a really, really well-respected sports psychologist that, if you want to become an elite player, if you want to work at the elite level, you have to train at the elite level. And we are all elites. There are very few people on this planet who can do the kind of work that we do. And we need to care for ourselves, and we need to be fit for that work. And then with maturity came the realization that I can't do everything. I had to learn how to delegate and trust people. And I also had to learn a distributive leadership model where in the Department of Surgery, I have 2 vice chiefs and I have 5 division chiefs. And I rely on all of them to do all the operational work within their domains. In the dean's office, I had 5 assistant and associate deans. And again, I relied on all of them to do the work that was within their domain. And by mentoring them and by trusting them and by putting them in charge of things and by keeping them on time and by having deliverables, they developed into really, really high quality professionals. And this is the way that we mentor and we make new leaders. Here's some resources. These are all 2021 resources. These are very useful. One's from the American College of Surgeons, one's from the Royal College of Surgeons in England. The one in the middle is a really wonderful PDF. It talks all about work-life balance specifically for surgeons. And with that, I'll stop and take questions, or I'll let them defer it to the reactor session. We're in a review of the objectives now. Academic surgery includes patient care of all types, synchronous with teaching, and research is the creation of new knowledge, which is required in the Academe. And it's required to become successful in leadership and administration. As your career advances, you will shift away from pure clinical work into leadership tasks and administration. You can do the most for the most when you're in these positions, but you still must keep in touch with your clinical life. Work-life balance is quantifiable, it is measurable. It's about finding peace and balance. And unless you take that task on, you become, you actually become abused by your schedule as opposed to the master of your schedule. Factors that increase and decrease work-life balance are modifiable and well understood. And some useful strategies and tactics that include time management, attention to personal health, keeping friends and colleagues close, prioritizing high-impact work against trivial work, and it includes professional development training. And I'd like to thank all of you. Appreciate the opportunity to speak.